Raj Govindaiah has served as Senior Vice President and Chief Medical Officer at Memorial Health System since April 2010. And he's the Treasurer's Office Outstanding Service and Leadership Awardee this month. He's responsible for quality, safety, and performance improvement in addition to medical staff, graduate medical education, and physician alignment activities. He collaborates with medical, clinical, and administrative staff to advance the clinical environment across Memorial Health System. Originally from the Quad Cities, Dr. Govindaiah is a graduate of the University of Michigan Medical School, which I will not hold against him, and he completed his residency in internal medicine at St. Joseph Mercy Hospital in Ann Arbor. Dr. Govindaiah earned a Master of Business Administration degree from the Kellogg School of Management at Northwestern University, and a Bachelor of Arts in Finance from the University of Illinois at Urbana-Champaign, which I think officially makes him an Illini more than a Wolverine. Do I have that right, Raj?
Yes, you do.
Great. Well, after completing your residency in Ann Arbor, what drew you to Central Illinois and working at the Springfield Clinic?
Well, first of all, thank you for the opportunity to be here today. As you said, I'm from the Quad Cities originally, born and raised Moline, Illinois, and wanted to come back to the Midwest. And my wife was from Ohio, from Dayton, Ohio. And Springfield was between my hometown and her hometown. But it's kind of a hidden gem too. For a physician, which I am and my wife is, you have all the benefits of a small town, the ease of living, the convenience of living, and you have this sophisticated medical environment because of the School of Medicine and the services we can provide here. It was a diamond in the rough, and it's been great ever since.
Great. That makes all the sense in the world to me. As the Chief Medical Officer for Memorial Health System, I think the topical question is, what has it been like helping lead the fight against COVID this past year?
You know, I think all of us want to be in a position where we can have impact on our family, impact on our coworkers, impact on our community. And I feel like in my position, I get to help influence the way healthcare is delivered by Memorial Health System to benefit the community. And with the COVID pandemic, we saw how important it was for us to communicate with our community, with the public. So it's been tremendously rewarding. It's been hard work, but tremendously rewarding to have an impact on so many people in such a profound way. It's been hard, but this is
most certainly
every morning. This is what we want to do.
It's been hard for a lot of people, but we know those working in the medical field, it has been a really tough year. So my question is, how has the COVID-19 pandemic changed the medical industry in our country? And then I'll ask you to speculate, will those changes stay in place? Do you see an evolution in the medical industry as a result of the pandemic?
I love that question. There's been so much change in our society, in medicine in particular. We need to do a much better job of meeting patients when and where they need us. So telehealth in Central Illinois, how do we meet rural communities' needs? If you're in Chicago, how do you meet the needs of individuals in the inner city who might have transportation challenges? And we're seeing that now as we try and vaccinate people. And there's so much better that we could do to meet patients when and where they need us, as opposed to in our big fancy buildings and asking them to come to us. So I hope that's how medicine changes, that we really move out of the four walls of the hospital and into the community so that people never need to come to the hospital. So I'm really excited about that opportunity.
Okay. So I am sure that this last year, the pandemic has taken a lot of your time, sapped a lot of your energy. We talked a little earlier about being curious. You're a curious individual. Maybe you can fill in our listeners, aside from work, what are some of your passions, some of your hobbies that one, have helped keep your sanity and that help with your sense of curiosity?
So in the beginning of the pandemic, it was really weird. I'm talking to a bunch of my friends and they can't go to work, right? They've all been quarantined, everything's been shut down, and yet in healthcare, we were going to work. It felt like 24/7. And I really realized the impact this was having actually on my own family, because they're not in school. We haven't figured out how to do remote school yet. So the things that we enjoy in the pandemic, being reminded how important interpersonal relations are with my friends and family and my extended family. This is Asian Pacific American Heritage Month. I'm raising, 2 young girls with my family in an area that is diverse and open-minded, but doesn't reflect the diversity of our whole country or our whole world. So one of the things that we've committed to doing is to traveling and showing our kids the diversity that exists in the world. And I really look forward to getting back to doing more traveling, not just to visit family, but to show our kids what's possible out there.
Yeah. Now, are you willing to share? Have you talked with your kids? Do they get to choose where you go? Do they have some top 10 spots they want to go to study? Or do you have some place in mind do you think would really benefit them seeing?
Yeah, we've had the good fortune of doing quite a bit of travel. We decide as a family and take trips. If you were to ask my 2 girls, their favorite trips have been to India. Obviously, we're of Indian heritage, and Egypt. The history in Egypt just blew them away. So I think that's what they'd say that their 2 favorite trips are. I wish I could tell you what the next trip is, but I feel like that's getting a little ahead of myself.
I understand. I try and do the same thing with my daughter to give her exposure. I think it really is one of the best gifts parents can give to children. But speaking of gifts we can give to others, maybe you can leave our viewers with a gift. Any words of wisdom you want to share with individuals following in your footsteps, not just into medicine, but people who want to be agents of change and do good for their fellow man?
Yeah, that's a incredibly complex question, but I would say your success in life is based on a couple of key things. Some of them are out of control, like how bright you are. God gives you that. How hard you work. That is a decision you make every day. And how well you work with people, the curiosity you show in exploring the world. And I think that's something that we can try and be better at each and every day. So if you go out there, work hard, follow your passions, and listen, you'll find that the world is a remarkable place and you can do remarkable things.
Well, that is great advice. You can't necessarily choose certain qualities given to you, but you can choose to work hard. You can choose to be kind. And you've been very kind and generous to us with your time. We know you have a busy day. Very kind and generous with the people of Central Illinois in your service. And thank you. Congratulations for this award for your contributions to leadership in your community.
Thank you so much.